There is usually a lot of joy associated with the announcement of a pregnancy. But you should remember that as far as the body is concerned, pregnancy is a medical condition. The more you know and understand about the risks involved, the more likely it is to avoid them, as well as be informed of what to look for and what to expect if things don't go according to plan. Not only can delivery complications lead to increased medical costs and extended hospital stays, but they can negatively affect your health or that of your baby. Not to be overly alarming, but it is a simple fact that delivery complications have increased in recent years. Between 2014 to 2018, childbirth complications increased over 14%. According to the CDC, the Centers for Disease Control, increased age of the mother, pre-existing chronic medical conditions, and pre-pregnancy obesity have all been contributing factors. To mitigate risks to both you and your newborn, it's wise to have medical staff carefully monitor you throughout your pregnancy and labor. That way, they can quickly intervene if needed. If obstetricians or other medical professionals don't manage labor and delivery complications, which include pre-planning in case of potential problems, mothers and newborns can experience severe and sometimes permanent harm. To be fair, labor and delivery often occur without significant problems. Ultimately, the probability of experiencing birth complications depends on your health history, current pregnancy, and the vigilance of your healthcare team. Severe complications are rare, and your doctor should be able to anticipate and resolve any difficulties effectively. And as scary as the percentages sound, pregnancy or delivery complications only occur in 7 of every 1,000 pregnancies. Certain women with medical conditions are at a higher risk of having labor and delivery complications, including women with cancer, diabetes, high blood pressure, epilepsy, kidney problems, anemia, and sexually transmitted infections. Aside from these conditions, you should know that other factors can increase the risk of complications during delivery. Drinking alcohol, using illegal drugs, smoking cigarettes, a history of preterm birth, being 35 years of age or older, likewise being of very young age, eating disorders like anorexia, or pregnancy carrying twins or triplets. Pregnant women and their families should be aware of these increased risks. In addition to these conditions, certain forms of delivery come with their own varying risks. Vaginal delivery is the natural birth method, pushing the baby through the birth canal. Uterine contractions make up the first stage of labor, leading to dilation so the baby can exit the mother's body. The second stage of labor is the baby's actual birth, which can last from minutes to hours. The CDC says that nearly 70% of U.S. births occur from vaginal delivery. It's typically considered the safest option for both mothers and newborns. However, it is not without risks, including vaginal tearing, postpartum hemorrhage, prolonged labor, maternal distress, injuries to the infant, incontinence in the mother, and postpartum depression. Complications can worsen in labor induction, operative vaginal delivery, or when a doctor uses a vacuum extractor or forceps to deliver the baby. Operative vaginal delivery can be associated with pelvic organ prolapse and fecal incontinence later in life. The other most common option is a cesarean delivery, otherwise known as a C-section, during which a medical professional delivers the baby after making an incision in the abdomen and uterus. A doctor may recommend a C-section for several reasons. For example, if there has been prolonged or stalled labor, multiple gestations, fetal distress or complications, newborn malpositioning, such as herpes or HIV, an overly large baby, a previous C-section delivery, maternal complications like high blood pressure, or other reasons. Some expectant mothers choose delivery via C-section for personal reasons: fear of labor pains, anxiety about vaginal delivery, earlier negative experiences with vaginal delivery. feeling a need for control over the delivery process, or influence and pressure from friends, family, or social media. Regardless of the reason, a cesarean delivery comes with certain risks of complications. Blood loss more than vaginal delivery, incision infection, blood clots, injuries to the bowel, bladder, or surrounding organs, adverse reaction to general anesthesia or medication, potential complications in future pregnancies, or endometritis. C-section delivery can also result in breathing difficulties or surgical injury in newborns. Speak with your healthcare professional right away if you suspect any complications for yourself or your child after a cesarean delivery. Understanding these risks can help minimize their effects. While some are unforeseen and not unpreventable, early detection and treatment of others can mitigate injury to both you and your baby. It's critical to begin prenatal care as soon as you discover you're pregnant. Make sure you attend prenatal care appointments and reschedule any that you miss. Other screening tests, including OB/GYN visits, blood tests, and imaging appointments like ultrasounds, allow your doctor to monitor you and your baby's condition and keep track of the baby's growth, heartbeat, and overall health. Even if you feel like everything is going ahead just fine, these examinations are vital to help identify and plan for possible pregnancy complications. You'll want to pay attention to extreme fatigue, poor sleep patterns, high stress levels, and poor diet. These can all contribute to labor and delivery complications. When pregnant, you should get 7 to 8 hours of sleep as recommended. If you have difficulty sleeping, try to nap during the day when possible. Stick to a clean diet and healthy exercise routine, and do what you can to manage and lower your stress levels. You'll also want to avoid foods that may be harmful to the baby's health. Be wary of raw or uncooked eggs and lunch meat or cold cuts. Don't eat unpasteurized cheese and milk, and wash vegetables and fruits thoroughly. Make sure to cook meat thoroughly before you eat it. If you need help creating or following a proper diet during your pregnancy, talk with your doctor or get a referral to a nutritionist. It's best to stop using recreational or non-prescription substances at once after learning you're pregnant. Please understand that harmful substances like alcohol, cigarette smoke, or illegal drugs will be carried through the bloodstream to the fetus or can cut off vital oxygen or nutrients. Research has linked the use of illicit drugs to serious labor and delivery complications, such as preterm birth. Although quitting can be difficult, there are support groups available to help. Your doctor can provide you with guidance and resources to help you make the healthiest possible choices and stick with them. In addition to watching your diet, women with a pre-pregnancy BMI or body mass index of 30 or more are at a higher risk for developing labor and delivery complications. If you're overweight and want to get pregnant, talk with your physician about ways to achieve a healthier weight. The same is true if you are underweight. You can meet with a dietitian to make sure you receive proper nutrition and learn what to eat to both gain weight and support the needs of a growing fetus. You'll also want to check with your doctor about a proper regimen of vitamins and folic. Be sure to discuss any of your prescription drugs in case some can cause complications and birth injuries during pregnancy. Be sure to never stop or start taking any medications during pregnancy without discussing them with your doctor first. Be sure to talk with your healthcare provider about taking the right vaccines at the best time to keep you and your baby healthy. Most vaccinations are safe and necessary to prevent illnesses like the flu, pneumonia, or COVID-19 during pregnancy. Healthcare providers should recognize warning signs of labor and delivery complications that may endanger the mother and baby. Additionally, they should carefully manage your delivery, address any difficulties swiftly and competently to minimize birth injuries and minimize the severity of congenital disabilities as much as possible. Failure to follow the required standard of care makes up medical negligence. If a medical professional's negligent or wrongful acts lead to your child's injuries, you may be eligible to file a medical malpractice lawsuit. If the worst should happen, it's important to seek help from a birth injury lawyer who can investigate your case and evaluate your legal options. You'll want to have answers ready to the following questions. What appropriate medical standard of care applied to the health situation in which you or your child suffered an injury? What medical information was available to the care provider at the time of the labor or delivery complication? What actions did your healthcare provider take or fail to take during the situation? What would a similarly skilled healthcare provider have done in the same scenario? Was the deviation from the standard of care the cause of the sustained injuries? If liability exists, you may be entitled to financial compensation. A birth injury lawyer can gather the necessary evidence to support your claim and help calculate the cost of your injuries and other damages, including pain and suffering resulting from the medical malpractice. Your lawyer will start a lawsuit on your behalf if you decide to take legal action and negotiate a settlement or compensation award. There seems to be so much to remember about the causes of delivery complications and the means to reduce or minimize the risks. Fortunately, you can find abundant resources to help you learn more about delivery complications, causes, treatments, and more at birthinjurycenter.org.